the end of AIDS. That will only occur with some fundamental foundations. And these foundations are the basic and the clinical research which will give us the tools which will ultimately lead to interventions, and then ultimately these will need to be implemented, together with studies about how best to implement them. This will not happen spontaneously. What it will require are the things that Secretary Clinton spoke about when she introduced the possibility in November of 2011 at the NIH of an AIDS-free generation. A lot of people, a lot of countries, a lot of regions have a lot to do, from country ownership, capacity building, health system strengthening, increased commitment by current partners, involving new partners, coordination, get rid of what does not work, concentrate on what does work, and remove the legal, political, and stigma barriers. Only then will this occur.
Bottom line, in the richest nation on the planet, barely a quarter of the people with HIV are in fully effective treatment. More than 70% are either not on treatment at all or on suboptimal treatment. That's bad for them, and it's bad for everyone else, because when they are not on treatment, they are much, much more likely to spread the virus. We, you and I, the people in this room, the people in the global village, the people doing work back at home every day who couldn't afford to come to this conference, have to change that. First, we must fully implement the Affordability Care Act. This will deliver health coverage to more than 30 million people who are currently uninsured. We want our families to love us and to support us, but they cannot love us if they don't know us, and they can't know us if we continue to hide from them. We need a massive investment in community education and HIV science treatment literacy. We need an army of peer patient navigators that link individuals to the care they need. 4, we need to integrate the biomedical and the behavioral in our prevention and treatment efforts. Because it is in the caring and the fighting and the loving that we live forever. This is our time. This is our deciding moment. Together, we are greater than AIDS.
Here today to make it absolutely clear. The United States is committed and will remain committed to achieving an AIDS-free generation. We will not back off. We will not back down. We will fight for the resources necessary to achieve this historic milestone. When President Obama took office, we knew that if we were going to win the fight against AIDS, we could not keep treating it as an emergency. We had to fundamentally change the way we and our global partners did business. So we've engaged diplomatically with ministers of finance and health, but also with presidents and prime ministers, to listen and learn about their priorities and needs in order to chart the best way forward together. Now, I will admit that has required difficult conversations about issues that some leaders don't want to face, like government corruption in the procurement and delivery of drugs, or dealing with injecting drug users. But it has been an essential part of helping more countries manage more of their own response to the epidemic, to get us on that path to an AIDS-free generation. We're focusing on what we call combination prevention. Our strategy includes condoms, counseling and testing, and places special emphasis on 3 other interventions: treatment as prevention, voluntary medical male circumcision, and stopping the transmission of HIV from mothers to children. And across all of our health and development work, the United States is emphasizing gender equality because women need and deserve a voice in the decisions that affect their lives. Some take actions that, rather than discouraging risky behavior, actually drives more people into the shadows where the epidemic is that much harder to fight. And the consequences are devastating for the people themselves and for the fight against HIV. Because when key groups are marginalized, the virus spreads rapidly within those groups, and then also into the lower risk general population. We are seeing this happen right now in Eastern Europe and Southeast Asia. Humans might discriminate, but viruses do not. And there is an old saying that goes, why rob banks? Because that's where the money is. If we want to save more lives, we need to go where the virus is and get there as quickly as possible. We all have a shared responsibility to get serious about promoting country ownership. The end state where a nation's efforts are led, implemented, and eventually paid for by its government, its communities, its civil society, its private sector.
Thank you all for being here today. Let me begin with a question for Mr. Gates.
Well, the key metrics you want to work on is reducing the number of people infected each year and the number of people who die each year. And so you need a ruthless understanding of why those people are still dying. You know, country by country, looking at, you know, these are ages, 20s and 30s, where people don't die of much. If it's not a car wreck, it's not delivery, you know, they're just not much. So seeing those excess deaths and really tracking back and saying, okay, why didn't they get on treatment? If they were on treatment, why didn't it work? You know, the diagnostic system that drives improvement and quality is going to be fairly straightforward here. And we have countries who are doing their treatment for way less than half of other countries. Particularly in the non-facility cost areas, there's huge variation. One thing to say about the vaccine, which, you know, is a fantastic thing, if you get a vaccine, say in 10 years, then the number of people you need to put on treatment is reduced in about 18 years. And so the pool of people that we need to treat, unfortunately, there's this unbelievable lag time that comes out of that. So even though, you know, I'm thrilled with the progress on the vaccine, it's not some fast arrival. Now, if somebody could cure AIDS, which unfortunately that's very much a long shot, there are people who are working on it, that would change the whole picture here. But it's probably not in the cards, at least anytime soon. And so that's why this treatment imperative is so dramatic.
All right, let me get to a few questions from the audience before we break here.
But compared to other ways that money spent through PEPFAR and Global Fund have clear life-saving impact. You know, the fact that there have been a few incidences where the money went astray, first of all, that's been a very small percentage of the money. And second of all, they've gone in and remedied those things. And so then any notion that these programs are not high impact per dollar is just wrong. You know, our foundation is very tough on these metrics, and that's why, you know, we're providing, you know, our endorsement to what they're doing. Okay.
I'm here to deliver to you and to anyone who will listen the message that saved my life, the message that can save millions of lives if we put it to practice. No matter who you are or who you love, no matter where you live or how you live, no matter what you have or haven't done, everyone deserves compassion. Everyone deserves dignity. Everyone deserves love. Why am I telling you this? Because the AIDS disease is caused by a virus, but the AIDS epidemic is not. The AIDS epidemic is fueled by stigma, by hate, by misinformation, by ignorance, by indifference. There's so much talk now about the end of AIDS, and rightly so. We can end AIDS thanks to you out there. You have made it possible. Because of your research and your advocacy, we have life-saving treatment and we have prevention. Cynical people will say, oh, how can a sentiment possibly beat a virus? If you show compassion, no one will be forced into the shadows. If you show compassion, no one will be afraid to seek treatment. Do you want to stop the epidemic in South Africa? Then show compassion by telling those living with HIV to be proud of knowing their status. That's what the South African government is beginning to do, and it's working. We need to put our arms around people who are HIV positive, celebrate the actions of individual change, celebrate people who are willing to get tested. That's the compassion that will help get everyone tested and on treatment. Do you want to end the epidemic in America? Then show compassion to those who can't afford treatment and are on waiting lists to receive it. Show compassion for HIV positive people in Washington, D.C., most of whom are poor and black and forgotten. Even though they live in the capital of the richest and most powerful nation on earth. America has shown so much love for those living with HIV in the developing world. If this country wanted to end new infections at home, it could do so in a heartbeat. Together, we all need to combine our talents, our knowledge, our technical ability to get the message across about AIDS. And we are doing this. I'm very optimistic. I'm a Luddite. I have no idea how to tweet. I can sing, but I can't tweet. I know I sound idealistic, but if you don't have a vision and you don't have a plan, then you are nowhere. And my vision is for people to be much more tolerant of each other in every way possible, to be more compassionate, and then we can all embrace this idea of getting rid of AIDS, getting rid of the cost, not only human lives cost, but of the incredible cost of billions and billions of dollars a year, and put it to good somewhere else. We can beat this disease, but we need to do it together. And we are doing it together. And all you people out there are helping. God knows how you're helping. So thank you for coming today. Thank you for listening. And Let's have an AIDS-free world soon, okay?
Thank you all very much for coming.